So coming to the next question, the inclined plane appliance it is used for the correction of. The answer is anterior crossbite. The inclined plane appliance it is used for the correction of anterior crossbite. So this one is the anterior crossbite. It is a condition where the anterior crossbite it is a condition where the upper front teeth they are positioned behind the lower mandibular incisors when the jaw they are closed. Now what are the things that we can use for the correction of the anterior crossbite? The first of all we can use is the tongue blade. So this one is example of tongue blade. The tongue blade, remember, they are particularly used when a crossbite is observed during the eruption of the permanent teeth, especially in the pre-adolescent patient. The tongue blade, remember, it is a simple and inexpensive appliance resembling a flat ice cream stick. So the tongue blade is placed inside the mouth with the surface contacting the erupting tooth that is in crossbite on its palatal surface. So upon the slight closure of the jaw, the opposing side of the tongue blade comes in contact with the labial part of the opposing mandibular teeth. So this point it will act as a fulcrum, allowing for the application of light forces to gradually correct the position of the erupting tooth. So the forces, remember, the force it can be generated either by rotating the oral part of the blade labially or by holding the blade stiffly and closing the jaw slightly to a tolerable extent. Other appliance that we can use is the Catalan appliance. So inclined plane appliance it is used for correction of anterior crossbite. So this one is the anterior inclined plane that is cemented on the mandibular incisors. So it is typically associated with non-removable appliances as they are cemented in place. The lower inclined plane, remember, it is constructed at an angle of 45 degree to the maxillary occlusal plane and can be made up of acrylic or cast metal. The other we can use is the jet springs. Or the double cantilever spring that is also known as Z spring. It is commonly used for correcting the anterior tooth crossbite as it has a double helix between the two parallel arms with the inferior arm extending as the retentive component in the acrylic base plate. Apart from that, we can use are the screws. They can be micro screws, mini screws, or medium screws. Now coming to the next question, what kind of coupling of dihydropyridine with ryanodine in skeletal muscle it is seen? The answer is electrical followed by the mechanical. In skeletal muscle, the coupling between the dihydropyridine and ryanodine receptors involves the electric as well as the mechanical signals. So the electrical signals, when an electrical signal such as nerve impulse reaches the skeletal muscle, it triggers the opening of the dihydropyridamine receptors channels. So the opening of dihydropyridine channels allows the calcium ion to enter the muscle from the extracellular space. Apart from that, you can see is the mechanical response. The entry of the calcium from the dihydropyridine receptor stimulates the nearby ryanodine receptors on the sarcoplasmic reticulum. So that is a storage site for the calcium ions to release even more calcium ions into the muscle cells. So remember, this increase in the calcium ions with the muscle cell initiate the contraction process leading to the muscle movement. So the answer is D. Now the muscle that aid or support the movement of other muscle, it's synergistic. Now remember that the prime mover or agonistic is muscle that produces most of the forces at a joint, whereas synergistic is muscle that aids the agonist, whereas the muscle that opposes the action of the agonist is the antagonist, and a fixator is the muscle that prevents from moving. So the answer here is C, synergistic. When a patient has increase in the plasma osmolarity, it will cause increased secretion of which of these? The answer is D, vasopressin. Cortisol. We know cortisol, it is a steroid hormone that is primarily released by the adrenal glands in response to the stress. So while the cortisol do not have some effect on fluid and electrolyte balance, its main role is in regulating metabolism, immune response, and the stress response. So cortisol is not your answer. Anti-natriuretic peptide, it is a hormone that is released by the atria of heart in response to the stretching of the atrial walls, typically due to the increase in the blood volume pressure. So its primary function is to promote the natriuresis, that is excretion of the sodium ions in the urine, so leading to increased urine volume and a decreased blood volume and pressure. So ANP promotes vasodilation that inhibit the release of renin and the aldosterone that helps to reduce the blood pressure and fluid volume. Renin, it is an enzyme that is relieved by kidney in response to various stimuli like the blood pressure, low blood volume. So its main role is in renin, angiotensin, aldosterone system. So renin catalyzes the conversion of angiotensinogen to angiotensin 1, that is further converted into angiotensin 2, that is a vasoconstrictor that stimulate aldosterone release from the adrenal glands, leading to sodium and water retention. The answer is D, vasopressin. Now remember, the increase in the plasma osmolarity it is detected by specialized cells in the hypothalamus of brain that are known as osmoreceptors. So when these osmoreceptors they sense an increase in the plasma osmolarity, they stimulate the release of vasopressin from the posterior pituitary gland. Now vasopressin will act on kidneys and cause increased water resorption. Allowing more water to be resorbed back into the bloodstream instead of being excreted in the urine. So as a result, less water is lost in the urine and more water is retained in the body. That helps to dilute the increased concentration of solutes in the blood and hence restore the osmotic balance. So when the plasma osmolarity increases, the vasopressin secretion increases to promote the water reabsorption in the kidney, reducing the water loss in the urine and helping to restore the osmotic balance in the body. So that is why your answer would be D here, vasopressin. Coming to the next question. The post-ganglionic sympathetic cholinergic innervation it is seen in. Well, the post-ganglionic sympathetic cholinergic innervation refer to the release of neurotransmitter that is acetylcholine by the post-ganglionic sympathetic nerve fibers on their target tissue. In some specific sweat glands, particularly those in areas like palm of hand and sole of feet, the post-ganglionic nerve fibers release acetylcholine. So these sweat glands are known as cholinergic sweat glands. On stimulation, such as in response to increased body temperature or emotional stress, the post-ganglionic sympathetic cholinergic fibers release acetylcholine onto the sweat gland receptors. Coming to the next question, which of following appliance is not example of maxillary expansion device? The answer is pendulum with a Hyrax screw. We know pendulum appliance, it is typically used for molar diphthalization rather than the maxillary expansion, as it consists of a diphthalizing spring that is attached to the maxillary molar. The other options, quad helix, Jones-Hicks and Hyrax, all are the example of the maxillary expansion devices that are used in orthodontics to achieve the transverse expansion of the upper jaw. Geometric glossitis is other name of benign migratory glossitis. So benign migratory glossitis, it is a benign condition of tongue that is characterized by irregular appearance or the map-like patches on the dorsal surface of tongue. So the term migratory means changing pattern of these patches which can move or change shape over time. So that is why it is known as a benign migratory glossitis. So the characteristic feature of benign migratory glossitis is the presence of irregular rhythmatus, means the red and depapillated areas on the dorsal surface of tongue. So they appear like a map. So the depapillated area, they will appear smooth, shiny patches surrounded by elevated white borders. So the answer is A here. Another question. The tubotympanic process it develops from, well, the answer is first pharyngeal pouch. So during the embryonic development, the tubotympanic recess extends from the first pharyngeal pouch. So this extension is formed by endodermal lining of the pouch. The tubotympanic recess ultimately give rise to auditory tube, that is the eustachian tube, and the middle ear cavity. So answer is A. Coming to the next question, the thickness of MTA plug in apexification is, well, during apexification, MTA is commonly placed at the apex of the tooth root to create a apical barrier. So this barrier would promote healing and promote the formation of hard tissue, that is dentine, in the root canal space. A thickness barrier of 3 to 5 mm ensure adequate seal and provide sufficient material for the barrier to effectively block the apex. So this range allows for optimal healing and prevent the micro leakage of the fluids and bacteria into the root canal space. So the correct answer is B.